My journey from the classroom to the grassroots was started in the year 2002. I completed my master's in social work. I was looking for an opportunity to work in this sector. So, a young man coming from a rural agrarian family background, not very fluent in English, or not very good in the academics, the job market was really daunting to me. I was not sure of getting a job which I want. So one day morning, one of my professor, Dr. Vinita Pai, she called me and said, Satya, there is an opportunity to work in an organization called KHPT. That time it was called AICHA. So they work on the issues around women empowerment. If you are willing to work on this issue, you go and approach them. The word women empowerment was really fascinating to me. I thought why can't I try? Next day morning, I went to the local office there and I gave my CV. They said, looks good. We are conducting a workshop in the next 2 days. If you are willing to take up this position, you come and join. I went to the workshop after 2 days and I participated, and in the workshop they said 3 things. You have to, this whole work is all about HIV/AIDS issues in the northern Karnataka context. Secondly, they said you have to work with the female sex workers. And thirdly, your designation will be SWDP coordinator. That means sex worker demonstration project coordinator. I was really confused. What is this? I was really looking for some fancy job titles, designation matters. That is the mindset I went there actually. Then I was really confused. My first question was after this, if I accepting this offer, what can I communicate back to my parents? That is a kind of a worry. And what others will look at me if I started working with the sex worker community. All these questions were roaming in my mind. So then finally I decided, anyway I am jobless, I don't have work. Let me try this for the next 2 months and fit the job. That is the kind of a mindset I decided to work. And they placed me in a district called Bagalkot. There was a sex worker collectives called Chaitanya Mahila Sangha. There I was a coordinator for the project. So at that point in time, HIV/AIDS in India was in an increasing trend. So Karnataka was one of the high HIV prevalence state among the 6, within the top 6, Karnataka was one of the high prevalence state. And Bagalkot district was the HIV prevalence in the Bagalkot district with the Karnataka was very high in the early 2000s. In fact, the HIV prevalence among the general populations was almost more than 5% among the rural population. And among the female sex worker, the prevalence rate was almost 33%. That means 1 in every 3 women were infected with the HIV. So that was the situation in Bagalkot. And secondly, Bagalkot district was known for the traditional form of sex work called Devadasi tradition, where the women enter into the tradition through a Devadasi form of sex work. If the mother is Devadasi and then the daughter is the Devadasi, that is the kind of a practice. So that is where we started our work, and our job was simple. There is a high HIV prevalence among the sex workers. You have to bring down the HIV prevalence. That was the kind of a task. But that was not an easy task actually. Everyone, including the government, international donors, international community, academicians, policymakers, everyone was thinking the prevalence can be bring down by working with this marginalized community, female sex worker or other high-risk groups, adopting a risk reduction approach. Basically working with them, providing a medical treatment, providing a counseling, awareness. This is the approach. If you can work out, then the things will really calm down. Okay, we went and started approaching the community. Then once we started interacting with the women, they said, HIV is not our issue. That is, we are least bothered about the HIV. That may be your issue or the government issue. We are least bothered. Our issues are different. On a daily basis, we are struggling with so many issues. If I come for the work, by end of the day, I'm not sure I'm going back to the home safe or not. I'm not really sure about it. I've been experiencing the violence from the different people, violence from their clients, violence from the intimate partners, violence from the gundas, violence from the police. When they're standing on the road, the police are coming and beating them. And I'm not sure whether my children are getting a very good education or not. I'm really worried about my daughters will end up with this profession. That is my worry, not the HIV or the AIDS. I don't know anything about this virus. Why should I worry about this? I think this is something my issue. My livelihood is my issue. Then we as an organization, we sat back and started thinking around it. Even though entire global world is worrying about this disease and like addressing this through a kind of a very epidemiological approach, we thought like that is not going to work. We realized that unless or until community take the ownership, community are in the forefront of this entire war, it is not going to change anything. Then we started working with Chaitanya Mahila Sangha, the sex worker collective in Bagalkot. And the women in the sex worker collective started taking the ownership and they were in the forefront. And a series of workshops, trainings, capacity building things started with these women. And they started raising their voice. They adopted an approach called peer education model where the sex worker started going and talking to their fellow sex worker in the community. Why I'm here, why you are here, and why we all need to work on this issue. That is the kind of an approach they started with the community. They started, the women in the sex work, they started conducting a session for the many stakeholders. I still remember there was a woman called Kalavati. I was in Bagalkot and we were conducting a workshop for the police personnel because there was a violence from the police and there was a session happening. So basically Kalavati before entering into the dais, there were other senior officers. They talked about the importance of working in this issue, the technical session they conducted. Kalavati entered into the dais wearing the sari on her head and she said, brothers, namaste, you all may have seen me in the street and I'm here to take the session to you on this topic. There, I can sense the kind of a body language and the people in the room, like what is this lady is going to tell us actually, what she is going to teach us. Kalavati started her session saying that I have taken this profession not by choice. The circumstances made me to take this kind of a job. And she explained her story and how you need to be empathetic with a woman and why it is so important. Like she has explained the entire story in the session. At end of the session, some of the police officers were literally cried actually. And they said, we never saw the women in sex work practicing on the roadside in a humanitarian manner. We always kind of I have to perform my duty, I have to take, like, that's it. Nothing, nowhere. I never thought of it, but I realized now. So that is the kind of a power, like the community started communicating their issues, their concerns in a more powerful way, in a more better way than anybody else actually. Any technical session more better than these sessions, and that started making a big impact. So with all this kind of a work by the collective, I think by end of 10 years down the line, there are many changes were happened, along with the reduction of the HIV prevalence and incident rate in the district. First thing, the Bagalkot HIV program became one of the learning site for the India at the global level. The people from all over India and African countries started coming and interacting with these women. They started learning from these women how a kind of a community-led intervention can be done. They become a teacher for the many people all over the world actually. And secondly, in the whole process, there are 20 community-based organizations started and Government of Karnataka started funding to them. Thirdly, there are many number of women leaders emerged in this whole process and they started raising voices. They started fighting for their rights. And fourthly, these women self-esteem, agency, confidence level made them to kind of think, and especially the community women, they started thinking that this kind of in a Devadasi tradition or this kind of in a practice should end at my level. It should not continue. I don't want my daughter to kind of in a take it up actually. This whole exercise taught us many lessons to the people who are in the public health sector or people who are in the development sector, people who are thinking to work with the community, taught many lessons the community, these women taught them actually. So this is my first journey from the first lesson or first the kind of a story from my classroom to the grassroots. And second story, exactly after 10 years, 2012, I got another opportunity to work with the adolescent girls from the marginalized community. As you all know, adolescent is defined as those who belongs within the age group of 10 to 19 are considered as adolescent population. And in India, there is about 21% of the populations belongs to the adolescent age. And adolescents are vulnerable. And if you take in Karnataka situation, there are about 21% of adolescent girls getting married before age 18. As per the recent National Family Health Survey data, about 21% girls getting married before age 18. There are more than 50% of the girls are malnourished or they are not practicing the proper menstrual health practices. There are about 14% of the girls drop out from the school before completing their 10th standard. This is the situation. So we thought like we need to work on this issue. This is an important issue to address. And I remember we had a kind of a workshop with girls in Belgaum. And we asked one question to the girl. Who is your role model? Whom do you aspire to be? The answer was, there are three people they were indicating. The first role model is my mother, because she is the one taking care of me and she's spending her whole life for the well-being of the family. She's the one struggling in the family. And the second one is the teacher. If we have a female teacher in the school, she's my role model. And the third one is someone in a very abstract role model that we read in the history book, either Kitturani Channamma, Vanake Obava, Kasturba Gandhi. They are the one we heard about them, but I don't know about them. So this was the situation. So the thing is, the idea of role model is completely lacking. There is no girl or nobody in the local, in the next door whom I can really aspire, I can really follow. That kind of an environment is not there. So then we thought, like, why can't we create a concept called role model? There is a program called Spurti Girls Lead Girls. We started working and conceptualizing that concept. So we identified about 51 villages in the Koppal district and identified around 600 girls as a role model girls from the 51 villages. And we started working with them. Basically, there is a 1-year intervention with a girl, and the intervention is basically exposing them to a kind of a different activities. There was a life skill education module for the 6 months was conducted at the village level. There was a leadership and communication trainings were conducted for them. They learned the assertive communication skill, when to say no for certain things. And the girls were also started getting a space in the public spaces. There is an activity called Samvada. The girls will have an interaction with the boys, with the community leader, with the parents. Like that. Like girls also visited different places outside of their villages first time, had an interaction with the women achievers. So all these things started by the girls. They started participating. And after the intervention with the role model girls, once they undergone the kind of an intervention, they started working with the other peer girls in their village. These 600 girls started working with the 3,500 girls in the 51 villages. And another important element we learnt in the whole process was the kind of a relationship between the girls and their parents. In many of the village contexts till today, once the girls attend menarche, they are not really talking to their father especially in the village context, and because they were considered as a woman. So that is the situation. The head of the household is the father. If the girl is not really interacting, what is her aspiration, what she want to do, and then how can really she move forward? How can she really get the support? So we started working with the parents, especially with the father and the girls started going back and interacting with their parents. If on the way, many places, if the girls are going from the house to the next village for the high school, many times boys were teasing them. Because of boys teasing, the parents are like asking them to drop out from the school. So then now the girls started going back and telling like what is happening on the way and why, like this is not my mistake. And she started responding back with the boys and also with the parents. And that bring a kind of a little more confidence with the father. And then they said, the girls started conversing with the father and mother. Most of the time you all think that even in your later age, the son will take care. That is not necessarily true. The girls can also take care of their parents in their old age. You don't need to worry about that. And many girls said, Appa, nange 5 varsha time kodu. Nan mundina 5 varshadalli nan education mugustini, graduate ಆಗ್ತೀನಿ, then maduve ಬಗ್ಗೆ ವಿಚಾರ ಮಾಡ್ತೀನಿ, ಈಗ ನನಗೆ ಮದುವೆ ಬೇಡ. They started communicating these messages very strongly with their parents. And I think that made a big shift in the whole process, where the Child Marriage Act is there. With all this act, with all the police, with all the vigilance, the child marriages are happening in the night and then like everything is done. That's how it's showing. But if the girls started making the decision, if they are kind of resilient about these things, the changes is much, much easier than any other things actually. Nobody else is required. And we always think that the adolescent can't do much actually, but that is the age, a powerful age. They can really make a big shift in the community. So that is what we learned from these young teachers, and that became a kind of a big change. And this program, this learning happened from 2015 to 2018. And 2020, the Government of Karnataka identified this whole, how it worked. And they scaled up this program to the 7 other districts. And now we are working with around 2 lakh adolescent girls in the Hyderabad, Karnataka and Kalyana, Karnataka region. So they are the big change maker. So my key takeaway here, so we as a student, we as a academician, we as a teacher, we as a NGO personnel, we as a government always think that the marginalized community or the community, they don't know anything. They are the illiterate. They are the ignorant. That is not true. According to me, every community has their own potential to solve their problem. They have immense energy in it actually. But the only thing is that energy needs to be channelized in a certain way. Then definitely the miracle can definitely happen. So these women and these girls, how they made the impossible become possible just by following 4 principles. The 4 principles were like the 2C and 2T. The 2C are, they are coming together and the kind of a coordination between them. And the 2T are the teamwork and the trust. So this made a kind of a big shift and big change in the entire work. And now, after 20 years down the line, if I look back my journey, where I started in 2002, I wanted to go back home in the next 2 months. I'm still working in this sector. My perspective have completely changed. Now I'm confidently say that these girls and these women are my real teachers for the patient movement.